So my name's Jade. I'm a clinical scientist in neurophysiology at Guy's and St Thomas's. So today I just wanted to give a brief overview of the importance of reflective practice, and in particular why it's important to reflect in the position in a patient-facing role. If anyone has any questions or any comments throughout, please just feel free to jump in because I can't see hands or anything. So yeah, please let me know. So what is reflective practice? I personally think it is personal to everybody what that might mean. So I think if we just dive straight into the definition, I'm sure everyone on the call probably has come across reflective practice before. But it's a critical thinking about our actions, so what we've done, our experiences and decisions to improve our future performance. So looking back on things that we might have done, for example, a patient encounter, analysing that ourselves and seeing how we can improve that in the future. So that would be called reflection in action, which is what we do when we're currently in the situation. So if I'm with a patient, I might be thinking, how could I do X, Y, and Z now? Or we can do it after an experience. So we can look back and see how could I have done better there, or what did I do well and what would I do again? And finally, so some context, so self-awareness and ongoing learning to keep enhancing patient care and professional development. So that just means that it relies on us to be aware that we do need to reflect. No one's going to say to us like, oh, you must reflect now. We need to be self-aware and know when it's going to benefit us the most. So understanding those situations that do require reflection is really important. So why do we need to reflect? So I've just put down a few things here, a few opportunities on when it might be useful to reflect. So it's useful to improve patient care, which I've already touched on. So looking on how we can improve every patient encounter. You might find if you are a patient-facing scientist that some things that you've done have worked really well and you've built a brilliant rapport with the patient. And you might want to take those skills forwards and sort of start to refine those every time you see a patient. Again, self-awareness, which we've already touched on, it can help us to sort of dig deeper and get to know ourselves better if we reflect on our self-awareness. Continued learning, building our confidence in certain situations. It helps with stress management, ethical decision making, and also enhancing teamwork. So how do we engage in reflective practice? So this is sort of a step-by-step process here. But I mean, I think many clinical scientists, they might not reflect, and that's because there can be some barriers, such as requirements of time and engagement. And that's something that as healthcare workers, we're not always rich in. But this nice 4-step reflection process can be quite helpful. Just to help us to start reflection. So this can either be sort of internal, or you can write these steps down. Many people journal reflection. I personally find that I find it quite useful to just do it internally, but journaling can be really useful, especially if you're learning how to reflect. So we've already touched on this at the beginning, but if we describe the situation, so in particular what happened, analysis, so a true reflection on what you did and the thoughts and feelings during the experience. And that's when reflection in action can actually be quite helpful, because it's a true reflection on how you feel at the specific time rather than a reflection afterwards. I personally think a combination of both is best, because you may find that you feel differently afterwards. So reflecting in both on inaction and following is really important. Evaluate what then happened. So assess the impact that this has had on the patient. So the patient encounter, in my situation as a patient-facing scientist, Or if you're reflecting on something else, such as giving a presentation, running an MDT, something like that, you can assess the impact on your colleagues or your team. And then formulate. So look to see how you can improve in the future or what you might take forwards. And although that process is quite simple and straightforward, the 4 steps, naturally there are, of course, tried and tested models that I'm sure many people on this call will have come across. So many of you have probably come across the more famous reflective cycle, which is Gibbs, but there is also John's model of reflection. So these are both cyclical models. They allow us to sort of dig a little bit deeper on those experiences, and it allows us to pull from what we've been through and sort of dig deeper, ask more questions. And I suppose the deeper our reflection, the better our continued practice and what we can take forwards. So these models are really, really useful if you're especially just starting to reflect or you're not too sure how to reflect. I think both models or a combination of both can be quite useful. So when should we be reflecting in healthcare? So I personally think that the most productive self-reflections are usually after challenging situations, or also in particularly rewarding situations too. So it's important to reflect on the positives as well as sort of constructive reflection. I like to think about reflection when I'm doing it myself as sort of giving myself feedback. So what went well, what could have been better, and any other reflections on that too. So we can reflect at regular intervals. It says here at the end of each shift. You can reflect with your team sometimes, and that can also help with debriefing. As I've already touched on, so after challenging encounters, during supervision, so many consultant clinical scientists or many trainee consultant clinical scientists will be involved in both supervision and teaching situations. So using that as an opportunity to reflect and learn and improve on how you are as an educator as well as a clinician, that can be really useful. And also for following training. And I think it's also important, which I've not got on the slide here, but to reflect, especially when things go wrong. So nobody's perfect, and occasionally things do go wrong. I feel like this is when reflective practice is really your friend. So I know it can be initially quite uncomfortable dwelling or reflecting on what went wrong. But if you reframe that as a reflective exercise, I think it can be one of the most useful strategies for improving in the future and ensuring that things sort of don't go wrong again, or the same issues don't happen with other people. For me, I think reflecting when things go wrong is probably the most vital use of reflection. And again, just some benefits. We can benefit as clinical scientists in our personal growth, especially in enhancing our self-awareness and emotional intelligence, in our professional development, so improving clinical skills and knowledge. It can help us to foster relationships within our teams and in multidisciplinary teams as well. So if we work across organisational boundaries, reflection can be a really useful tool for developing those relationships and strengthening those bonds. And patient safety, so it helps us to identify why errors happened, or if anything is a risk that needs attention. But as I've already mentioned, there are barriers to doing reflective practice, and one of the major barriers is time constraints. So I think the problem is that we're all very busy as clinical scientists, and often there's little time left to focus on the reflective practice side of things. It can be quite emotionally exhausting to reflect on certain situations, but I think trying to integrate just a few minutes, even like on your commute home, something like that, just reflecting on how a certain situation went, can really help you to debrief certain situations for yourself, and also to reflect and look over the day without becoming sort of party to time constraints. There can be a lack of support sometimes, so not everybody wants to reflect. So I think it's making sure that the culture that you're working in is allowing you to do that process. And lots of people have a fear of criticism, so I think that feeds into that somewhat. So creating a non-judgmental environment where people are okay to admit that they've made a mistake or that something has gone wrong, and reflecting on how to improve that in the future. So just to conclude here, reflection is one of those topics where people, they might feel like they don't know what to say. For example, I've had students in the past who have expressed a dislike of reflection because I think that the word reflection can feel quite daunting. But actually, I think there is a fear of how open reflection can be. It is quite revealing to reflect in either a positive or a negative way, because it lets those people around you know how you felt about particular situations. And that can be quite daunting. But my personal view as a trainee consultant clinical scientist is to lead by example in this way. So I think if others see you reflecting and using your reflection to learn and embracing that vulnerability, it can help everyone else in your situation to start reflecting as well. So to conclude, I think that embracing reflective practice is something that we should all be doing in our roles if we're able to.